Hello, everyone. As we all know, life is really unpredictable. No one can say what life has to offer in next step. There are some really good and bad experiences that we get to feel in life. And as part of those experiences comes traumatic events sometimes, which can be really painful, extremely shocking, and frightening as well. It's the reality of life. It comes and goes. We tend to recover with time, but not everyone can move out of it so easily. For some people, those traumatic events stay with them for a long time. Well, let me start with a question. Have we ever thought that being exposed to these sort of traumatic events in life can actually develop some sort of mental disorder in people? Well, if we haven't yet thought about it, it's time that we do some study on it because every year in only Australia, 4.4% of entire population develops PTSD. Now, what is PTSD? Well, that's exactly what we're going to talk about today on our presentation. Hello again. I am Binita Gautam Gajrel, and along with my group today, I'll be talking about post-traumatic stress disorder. But before I jump into the topic itself, let me quickly introduce my amazing team of 5 ladies, Sarni Stilji, Jade Copeland, Noor Kasam, Palak, and myself, who have come together to present some facts about post-traumatic stress disorder. Now, without any further delay, I'd like to move into the topic itself. PTSD. It's an anxiety disorder that develops in reaction to physical injury or severe mental or emotional distress, which is mainly followed by any traumatic events. It could be physical or mental. One should not necessarily have experienced those events themselves. Even witnessing something traumatic can be a cause for developing post-traumatic stress disorder. Serious accidents, sexual assault, domestic violence, losing loved ones, natural disasters like earthquake, flood, water conflict, and so on can be some types of events resulting in PTSD. People develop this disorder as they fail to recover after those events and tend to relive those experiences in their memories. As a consequence, they experience immense amount of fright and even feel helpless. This is exactly why people with PTSD often get flashbacks, nightmares, and severe anxiety, as well as continuous thoughts regarding the event. For now, I'd like to mention the areas that our presentation will cover, along with the name of our group members who have worked on different sections of the topic for our presentation. So we have Sarni Stilji, who will talk about a needs analysis of the person living with mental ill health in terms of its profile within the Australian society. Then we have Noor Qasim to present an overview of symptoms, developmental course, and common treatment approaches. Then we have Jade Copeland, who will present a description of relevant nurse interviewing techniques used to effectively communicate with individuals and families who may be experiencing the condition. And finally, we have Palak to outline one current Australian service initiative designed to improve care and reduce the impact of this health condition. So with this, we come to an end of our introduction. Here now is Sarni Stilji, one of our group members, to talk about needs analysis of the person living with mental ill health in terms of its profile within the Australian society. So, Sarnis?
Hi, I'm Shanaze, and I'll be presenting the needs of a person with lived experience of post traumatic stress disorder. Now, caring for a loved one or a client who is suffering from post traumatic stress disorder can be difficult. This resulting in some major impacts on the relationship, as triggers of traumatic past and battling with living in the present can make communication difficult between the two, causing lots of stressful situations. This will be presented in my slide as we go through a lived experience of a former Australian veteran and difficulties she faced with post traumatic stress disorder after her return home. Support plays a major role into the road of recovery. Awareness and education on post traumatic stress disorder can assist in better understanding on signs and symptoms one or loved one may be facing. This will need regular counselling sessions and follow ups with a psychologist or psychiatrist or counsellor. Listening and understanding to certain triggers, outbursts, or distress can assist in finding ways to better support those emotions of a traumatic past that is replaying in someone's memory. This can be done with recreational therapy, sport, or any alternative enjoyment. By doing this, it could also prevent substance abuse. Attending regular support groups can also assist, knowing that one is not alone with suffering from this disorder. And of course, in some cases, the use of regular medication may be prescribed and needed. Now, Belle's story. Belle's story is a former Australian veteran who served in the Australian Army. One of her triggers came from a place she served in Aceh, in Indonesia. In this story, Belle explains in detail her experience overseas and serving in Australia. She also explains her life thereafter, returning home and suffering with post-traumatic stress disorder. And in this, she states, there were nightmares and there were dreams, constantly stressed, constantly wired, constantly depressed, just battling with life. I think that after something like Aceh, nothing else can get you that excited anymore. Nothing else feels as intense, and therefore it is not as meaningful. But everything else feels so hard. You just want a normal life, and you don't know what the problem is. You don't realize how much energy is going into fighting to have a normal day. And in this describes in detail how she suffered from post-traumatic stress disorder and what was going through her mind at the time. Through this, her partner noticed her changes and played a major role into her support and road to recovery. This was done via lots of counselling sessions and therapy, and their goal was to have a healthy relationship. I'll hand over to you, Noel.
My name is Noor, and I will be talking about the symptoms, progress of illness, and treatment approaches. PTSD is characterized by multiple symptoms according to the DSM-5. There are 3 categories of symptoms related to PTSD, which include re-experiencing trauma, emotional numbness, and hypervigilance. For an official diagnosis of PTSD, one must experience certain symptoms under each classification for at least a month. To summarize the symptoms, it is usually marked by persistent low mood, avoidance of activities related to the trauma, easily irritable and angry, lack of sleep, and hypervigilance. It also involves reliving the trauma in a form of a flashback, reflecting the event in detail and detachment from usual activities. PTSD follows a specific trajectory. First, the patient is exposed or involved in a traumatic incident. Following this, and generally within a month, a patient experiences above identified symptoms. Approximately within a few months to a year, noticeable functional, occupational, and emotional impacts are evident. These include breakdown of current relationship, poor performance of primary place, work and study, and poor compliance to activities of daily living. Practice. 2 major treatment options for patients with PTSD have been proven effective. The first includes the providing of stimulation in which aspects of the trauma are present. This allows the patient to become desensitized to the trauma in a controlled setting. This has been effective in reducing the symptoms of flashbacks, hypervigilance, and avoiding activities related to the initial trauma. At the center of this therapy is reassurance and support. The second is use of cognitive behavior therapy, which involves using therapeutic communication with a patient to alter, modify behaviors between 4 to 6 months. Thank you.
Hi, my name's Jade, and today I will be speaking about interview techniques nurses can use to build therapeutic relationships with clients suffering with post-traumatic stress disorder and their families, and both verbal and non-verbal cues. Therapeutic relationships are a vital part of healthcare. When a client is brought into a hospital or healthcare environment, they're often unsure of the procedures and things that will be happening while they're in there. By actively communicating with the client, it helps makes them feel more calm and comfortable and prevents them from becoming angry and non-compliant, which can make providing quality healthcare really difficult. There are a range of techniques nurses should use when interviewing a client with post-traumatic stress disorder to help build a therapeutic relationship. The first step to building a therapeutic relationship during an interview with a client is to ensure you are actively listening to the client. This means addressing not only what they are verbally saying, but recognizing their body language and when they are beginning to feel stressed or uncomfortable, especially when discussing their previous traumas. Following this, when dealing with clients suffering post-traumatic stress disorder, it is important to show the client empathy. This can be done in nonverbal ways as well as verbal. Nonverbal ways to show empathy can include things such as offering tissues to an upset client and empathetic facial expressions. As we cannot always comprehend how a client is feeling, nurses should also avoid using phrases such as, "I understand." But the nurse should still validate the client's feelings and reassure them that their feelings are normal and reasonable. The interview with a client is possibly one of the most important parts of building a therapeutic relationship with a client. A fundamental part of building relationships with the client is to recognize that each person, their situation, and the reason behind their post-traumatic stress disorder is unique. The things one client finds comforting and helpful may be trigger or incur a negative reaction in other clients. By observing a client's reactions, the nurse can individualize the care for each client. It is also important when working with a client with post-traumatic stress disorder to listen to the client's triggers and recognize when a client is becoming triggered. An episode may be triggered by things such as sounds, visuals such as specific items or people, or even the specific words you may use. This may be in relation to the cause of their post-traumatic stress disorder. Furthermore, it also may be beneficial for the nurse to adapt their questioning. As previously discussed, every client is different, and it is important for the questions to reflect this. This can help encourage the client to communicate with the nurse they are speaking with and allow the client to share their experiences without interruption. This may include starting with general questions before moving on to more client-specific questions to establish a relationship first. It is also important when working with post-traumatic stress disorder clients to ensure you are communicating and building a therapeutic relationship with their family as well. This can involve explaining the family member's disorder, how to help them, and show care and empathy towards the family. Family are a critical part in a client's recovery, and having a therapeutic relationship with the family can make them more comfortable with accepting diagnosis, medical advice, and recommendations on their loved one. So, in conclusion, using these techniques are a vital part of healthcare and can definitely help in establishing a relationship and working towards a recovery for your client. Thank you.
Hey everyone, I'm Palak. My student ID is 1892121A. My group members have already talked about the post-traumatic stress disorder, and I will be continuing with one of the examples of the Australian service initiatives that has been taken to improve the care of the people living with the mental illness. Let's go. There you go. So I choose this plan that is with the 10 years of time period, and it is called Living Well, a strategic plan for mental health in New South Wales from 2014 to 2024. I believe it is a good example of the Australian Service initiative to enhance the care of people living with mental illness. We can also call them consumers. And it has been realized from the past years that government has not been funding the mental health appropriately. So they now decided to pay much attention and give fundings to the mental health and make it the mental health and well-being. In order to achieve this positive change, the government introduced the plan, which works on simple principles. According to the Living Well, a strategic plan for mental health in New South Wales, the plan is focused on the core values, which can be respect, recovery, community, quality, equity, citizenship, and hope. And there are various self-help tools, apps, resources, websites, because it's a technological world, and they're all available online for the consumers. For example, the Black Dog Institute's Compass, Lifeline, Kids Helpline, Mindsport, Beyond Blue, eHeadscape, Mood Gym, all of these are very helpful resources for them to utilize and recover. Moving forward, this plan focuses on the mental health care, shifting from hospitals to the community, and community hold the authority of collective voice from the different, because Australia is a multicultural country, so different people from the community want to give their voice, which are from different backgrounds, different cultures. They have also established the Collective New South Wales. It is a model which is designed to prevent vulnerable consumers. The plan also focuses on Aboriginal affairs and children and young people by prevention and early interventions. They also created this Conversations Matter. It's an online resource which helps the community to make decisions related to suicides. Not just this, the plan helps in recovery by providing employment to the consumers as well. If in this case, when consumers have no employment, it means they might be homeless or they have low income, so they provide employment to them, they provide education to them, they provide accommodation to them. And when providing care, therapeutic relationship, evidence-based approach, and everything's been contributed to make sure that we're improving the care overall. Moreover, the low-income consumers, as I already told, were given this, and other initiatives are taken into the address to convert the, not just the mental health illness, to convert this into the mental health well-being, especially for the LGBTI people as well. And they pay their mental health workforce to educate, give them extra training, extra practice related to the trauma-informed care as well. Overall, I think this is the best example I could give at this moment. And the Australian government and the New South Wales government are really trying to protect the people with the mental health illness, and then they can live their life with dignity and proud. Thank you.